According to National Jewish Health, there are around 5,000 students in the Denver public school system who have been diagnosed with asthma. Many more lack the health services to receive a diagnosis in the first place, and due to this face the effects of the respiratory disease without the needed medical care. In light of this large-scale problem, Denver Public Schools has partnered with local and national health advocates to design and implement the Denver Public Schools Asthma Program. The goals of this program are to increase overall education around the symptoms and effects of asthma, as well as to improve school health professionals' ability to deal with the consequences of asthma. If you were to visit the website for the program, you can find a checklist that can be taken to identify if a school is an asthma-friendly school, or if the school meets the available standards for mitigating the risk of asthma. While designed to look at both how the school is affected by asthma and how the school can respond to an emergency related to asthma, the checklist also asks for the survey taker to identify environmental factors that may affect the school's healthiness. The first of these statements reads, "The district uses the Environmental Protection Agency's Tools for Schools toolkit to improve indoor air quality." The third reads, "The district ensures that bus fumes do not enter schools or outdoor areas used by students." While there are many other standards, these seem to be the easiest for a non-school employee or a staff member to evaluate. What is interesting to note is that while bus emissions are specifically mentioned, no other source of pollution like cars or trucks is. While the school bus seems to be uniquely important for school health, there are other factors that play into this larger health as well. The EPA's toolkit includes a link to the EPA's Guidelines for School Sittings document, which was published in 2011. This document was published to supply potential schools with the information regarding the environmental impacts the location can play on students. While designed to advise the future building and remodeling of schools in unsafe areas, the findings of the study are important for evaluating existing schools as well. It seems that we'll be able to apply the same factors that would stop a school from being built to schools that are already built. If a school should not be built due to environmental factors, then why should we not also look to the effects that are being experienced by schools that are already built in the neighborhood? On this slide, the guiding principles behind the guidelines are listed. These are the guiding benefits and beliefs that have driven this study and the goal of this document sitting as a whole. What is encouraging about these principles is that other than making it clear that there is a link between school performances and environmental factors, the document also places a large emphasis on public engagement and information sharing. This recognizes first and foremost that the community around a school is just as important as the school itself, but also that what affects children at their school will also affect them if they live in the neighborhood. The document also makes it clear that one of the primary questions that should be asked in regards to environmental impacts in school is what are the effects on the least advantaged members of that community. Not only should this be a primary question in any political or social conversation, we also have to realize that the effects of asthma and school performance are experienced most by communities who have less in terms of capital. Just in terms of asthma, we can see a clear link between adequate healthcare coverage and the ability to meet that need for the family. According to pediatricasthma.org, the average cost of medical care per child per year is around $618. That cost rises to $1,042 for a child diagnosed with asthma. This means that a family with a child diagnosed with asthma can expect to pay more over the course of that child's life. The other issue is that according to the data from 1998, almost 40% of families who have children with asthma lack health insurance. In addition, say it is discovered that a school is not environmentally safe, or at least not healthy for the students, the families with fixed budgets will not be able to move their child to a school which is considered safe. This is because that for families living in poverty, the ability to use a car or afford tuition may be enough of a limiting factor to undermine their ability to make that choice. While the link between income and environmental effects seems too large an issue to adequately cover in this story alone, it seems to be something that we should keep in mind when we look at the issues surrounding air pollution. As producer and actor Danny Glover once said, if we talk about the environment, for example, we have to talk about environmental racism as well, about the fact that kids in South Central Los Angeles have a third of the lung capacity of kids in Santa Monica. These issues are real concerns and real consequences that are often compounded by other factors for families living in poverty, like class, geography, and location.